Absolutely, and immediately we'll start the Q&A session. Thank you so much, Shawna and Bryce, for this very compelling presentation. So the first question comes, talking about comprehensive fit for duty impairment policy. Are there any policies that cover all the aspects mentioned in slide 14 in place in the workplace? And if so, how effective are they? And is there any follow-ups with companies or organizations that have implemented such policies?
Wow, that's a multi-part question.
And I can repeat that. If would you like me to repeat the question?
I think I got all three, but
Okay.
if I missed something, let me know. So,
So,
in terms of comprehensive, I mean, as Bryce mentioned, when we looked at policies that were at least publicly available, again, there could be non-public policies out there that are very effective. The comprehensive policies, most of them, we really only found a few. When we said we found 15, we mean we really only found 15. And almost all of them were safety sensitive organizations. We did find one in the health practitioner field. And so these organizations have kind of an incentive to make sure that people aren't showing up impaired for work. And for them, a lot of them have gone through the lawsuits or they've gone through the incidents that have helped them refine their policies to become comprehensive. If you haven't gone through a lawsuit, chances are you might not be or gone through an incident, you might not be redesigning your policy. So that's why a lot of the time we recommend, have a look at the safety sensitive industry policies out there. The thing I caution about some of them is some of those policies still might have not the best language in them in terms of stigma and discrimination, but they're coming along. We see things refining and getting better and better. In reality, companies will always have to develop the policy that works best for them. In terms of effectiveness, Bryce and I haven't evaluated the effectiveness of anyone's policy, and based on, so we looked at, we talked to them, we did a poll, I guess I should say, and we did some interviews with employers a couple of years ago, and we asked them about effectiveness of their policies, and we asked them how they evaluated effectiveness. And most of them just reviewed their policies for being up to date, but didn't actually look at whether or not the policy was doing what they wanted. The few companies that did look at effectiveness, they looked at things like absenteeism, productivity, use of their health insurance plans. Those are all good ways to start. But if you really want to get at effectiveness, some of that needs to be done, usually asking questions anonymously at the employee level, see if there's been changes, asking supervisors. So there are different ways to kind of evaluate policies, but based on our experience, we didn't really see any organizations. I think we only saw a couple that actually did a true evaluation of their effectiveness. So, and out of the research that we looked at, the kind of the combination factor that we saw that worked the most in terms of evaluating effective policies, because the work environment is very dynamic. It's really hard to narrow down one thing and not attribute it to something else. But the combination of having a very comprehensive work policy, having peer support programs, and having a good organizational culture, those three were common to effective policies. And in those organizations that were safety sensitive and used testing as part of their policies, we also found that so drug testing didn't seem to be, there was no conclusive results of whether or not drug testing improved or reduced substance use, but they did see an impact, a positive impact, when testing was combined with a comprehensive policy. So when you're providing prevention and education measures, when you're educating your staff and you're introducing all these other measures, those tended to be the most, at least in the research, tended to demonstrate the most effectiveness in reducing substance use or impairment issues. I hope I covered all your questions, but let me know if I missed something, or Bryce, if you have something to add.
that was
The only thing
perfect.
oh yeah, sorry. You said the only thing I might add is just that I think in practice, and Shawna can attest to this, is that a lot of the organizations that seem to come to the forefront for having a successful health and safety culture really have an overall health and safety culture, and they often tend to be those safety sensitive industries where there's a culture that's really looking at, you know, overall fitness for duty, and it's very open, and everyone's looking out for each other in terms of making sure that someone is fit to do their job. And I think that sometimes safety sensitive industries have a little bit more emphasis on this because there is a real potential for harm to employees or sometimes the public. So again, that overall culture of safety seems to be in practice something that comes out when you're looking at organizations with a comprehensive or a successful policy. Thanks, Isra.
Thank you so much. All right, perfect. Next question was, so that's a multiple question as well. What kind of educational programs and training help with the challenges associated with substance use in the workplace? So are they directed to the employers or toward the employees? And can you give concrete examples of the components that the training would focus on?
Okay, that's an interesting question. So in terms of educational programs and training, this is kind of a new area. Like when we did the research, not a lot of people were looking at workplace, and we're actually, Bryce and I are working on something hopefully that we can develop in the future to start to address this. There are some programs out there. I'm just trying to think of the name of the one. There's one in the U.S. that's quite well used. It's a peer-to-peer program, and unfortunately the name escapes me at the moment, but I could probably send it to you. I think it's actually on the resource guide. I think we actually put it in the resource guide as one of the resources for a training program. I think one of the considerations though is all like businesses are all different, and because of that, what works for one business doesn't always work for another business. So if you have a transient workforce, such as maybe the service industry versus an office environment versus somebody driving a bus or trucks, these are all different types of industry. So usually the training programs, they'll have to be modified a bit to kind of compensate for whatever end goal you're looking for in your own environment. There are some online training programs or courses, I should say, for supervisors and managers. We do have those on the resources document. I know one off the top of my head comes from the Canadian Occupational Health and Safety Commission. And so so there are some on our resources. This is a new area though. And like I said, most organizations have kind of been developing them organically as they need it. But there are some coming out. We did put some up. Oh, there's another one also too. Sorry, it's on the resource guide. The province of Alberta, the government of Alberta, their health services have also put together kind of a package of information. And we haven't evaluated it, but we did have a look at it, and it looks pretty good. I mean, so those are things that you can look at. So the Canadian Occupational Health and Safety, the Alberta government, there's a peer-to-peer program, and we were seeing in the research that peer-to-peer programs are quite helpful. In terms of who they apply to, employers or employees, I think everyone needs prevention and education training in terms of how to handle an incident. That obviously goes to the managers and supervisors. So they might be the ones who benefit more from the occupational health and safety training, which I think is geared towards supervisors, whereas peer-to-peer programs are more geared towards colleagues and employees, because usually they're the first ones to notice a change in their coworkers before a supervisor or manager does. So that's kind of some of the ways you can kind of differentiate the training in terms of who to provide education for.
The only other one I might add from the resources, just the Mental Health Commission of Canada does have some training about mental health in the workplace, and I believe there is a component around substance use. There's also a broad range of resources around the National Standard for Psychological Health and Safety in the Workplace. So some of those resources would be useful in thinking through stigma and discrimination in the workplace and working with someone who has a disability. So those could be useful references. And again, sometimes not so specifically addressing substance use in the workplace, but addressing some of the same issues more from a mental health perspective.
Thank you very much for your answer. Next question is, so you've mentioned that it is important to reevaluate policies. Can you explain why this is important and how do you stay up to date? And do you have any idea at what frequency should policies be updated?
Yeah, I think it's kind of a hard question in terms of frequency of a review. Oftentimes organizations do have something like annually for all employees to review policies and that kind of thing. So it might make sense to have it in a cycle of yearly review. Again, there might be, if it's a more comprehensive evaluation, then maybe that doesn't happen every year. But in terms of keeping up, I think it's if you are reaching out to legal counsel, or if you are reaching out to other experts like human rights experts that do have a specialty in this area, they should be able to keep you up to speed in terms of any pertinent developments that you should know about. So that would be my first thought. Again, human resource experts, of course. And I think, we've mentioned this a few times throughout, but every organization is different. The resources that you have available, the size of your organization, is it a unionized or non-unionized environment, safety sensitive or not? So all of these different factors would potentially dictate how comprehensive your evaluation would need to be and the types of resources you'd have to put into an evaluation. But at the I would say, I wouldn't want to detract from any of the areas that we talked about, but the legal issues and human rights issues are probably very important to keep up with. And again, it might be out of the scope of anyone within your organization to really keep up with those, and that's where external experts come in. Shawna, do you have anything you want to add?
I think just kind of elaborating on something Bryce mentioned, if you want to keep it simple, like an annual review is usually sufficient, or every 2 years. If you're a safety sensitive industry, you probably will already be employing a lawyer to do this with you and your human resources expert. If you're a non-safety sensitive industry, largely you're just looking to make sure you meet the human rights code of conduct that is put out by the, so you can find that on the Canadian Human Rights, I'm drawing a blank on their name, Canadian Human Rights Commission website. They do have, they do outline the policy in a document. If you meet the basic human rights qualifications, if you set up your policy in consultation with a medical practitioner with expertise in this area, if you consult with your employees, if you do have a union, strongly advise getting them on board with you on this, usually you can develop a fairly decent and well-rounded policy as long as you have all the right people involved in the mix. And if it's not a safety-sensitive industry, that type of policy is likely to go much further distance in terms of review process. If you are a safety-sensitive industry where testing is involved, where there's legal aspects involved, that's something where you're probably going to need a lawyer who's keeping up to date with those types of issues. So we consult with a lawyer when we put together our research, and she specifically deals with impairment issues that come to court. So it really depends on your type of industry, but if you want to simplify it, probably going to need much more specific review if you're a safety sensitive industry, and if you're a non-safety sensitive industry, just make sure you have all the right people involved.
Makes sense. And I think our last question is, so what are the next steps to take in order to remedy to the remaining challenges that substance use in the workplace result in? In other words, what else is lacking, or what should be done in order to have an effective impact reducing substance use in the workplace?
I mean, just to add one thought off the top of my head was, our organization does a lot of work around stigma and reducing stigma. And oftentimes, we mentioned a lot of different experts to reach out to and to consult with. So, thinking about the role of stigma and stigma as a barrier within your organization can be an important and effective step. It's something that oftentimes can be invisible and not discussed, substance use and substance use disorders. So addressing and thinking about the role of stigma in your organization can be worthwhile. And it's something that doesn't necessarily come through. Shawna mentioned, those different experts to reach out to. They might not necessarily be in a position to talk about your organizational culture and the potential role that stigma is playing. So thinking about those aspects and thinking about how you might be able to address that as a barrier within your organization is what comes to mind for me. And again, it's something that we think about from our organizational perspective.
Yeah. I'll probably just add, just on a more practical level, one of the things we found is a lot of people just don't know what's expected of them. When we talk to employees, and when we look at policies, like I said, we looked at a lot of policies, and something that was really unclear in the policies was exactly what does it mean to be impaired, or what does it mean to take an impairing substance. Some policies are very basic and just said, don't drink alcohol. Well, telling somebody not to do something doesn't exactly tell them what the boundaries are with that organization. So one of the things is be very clear about what your expectations are from your employees so that everyone knows when someone's crossed the line, okay? In terms of another next step, make sure your employees know about it. A lot of employees don't realize they have some type of impairment policy or a workplace policy on these types of issues. And consistent messaging. So like I said, we talked to a number of organizations, and I'm remembering one off the top of my head when I was talking to him. He said that they had implemented a workplace policy on substance use, and he was the human resources director for this company, and he couldn't get anything to change. And his biggest thing was, even though they had a policy, the messaging and the organizational culture was still very much, it's okay to drink at work. It's okay to, it's okay if you happen to have something on the side while you're working. There wasn't really any kind of consistent messaging. So even though he, as a human resources director, had this fantastic policy by all accounts, he couldn't have an impact because the messaging was inconsistent at an organizational cultural level. So it doesn't have to be admonishing. It doesn't have to be, don't have parties. Lots of people have social host parties, policies. It just means make sure you're consistent about the message you're sending. There's a difference between being safe and healthy and being risky and potentially, non-productive or a risk to your colleagues or yourself. So those are three that come off the top of my head. Is just have a quick look at your policy and your organizational culture.